Hundreds of British hospitals are in the grip of a winter crisis. Patient numbers regularly surge during the colder months, but this year sickness levels have soared. To ease the pressure, health officials have banned doctors in England from carrying out all non-emergency surgery, such as cataract or hip replacement operations, until the end of January. People have been told to only go to hospital in a real emergency. Some patients are waiting 12 hours to see a doctor. Others are being treated in corridors. Medical staff are also feeling the strain. On Twitter, this doctor apologised for third world conditions at the hospital he worked in. "I shouldn't be in tears every day at work because of a lack of resources and lack of capacity," wrote this nurse. An estimated 55,000 procedures are expected to be postponed in the coming weeks. NHS chiefs have defended the move.
This is a planned response to a winter that we knew was going to be difficult, and we are managing that in the way that we expected. And we're taking early action. We're not waiting to have to respond to a problem.
The NHS is one of the UK's most revered institutions, offering free healthcare to all UK residents, but it's under mounting strain. So much so that this time last year, the Red Cross, the international aid group, said that if things didn't improve, that it faced a humanitarian crisis. 12 months on, and the NHS is still struggling to cope. Many doctors blame successive governments for starving the service of funding, all in a gradual attempt, they say, to privatise the public health service.
We've seen the NHS over this decade undergoing the biggest funding squeeze since it began, so over those 70 years. And what we've seen in this decade is approximately £40 billion of cuts by the time we get to 2020, and that's simply unprecedented for the NHS. It's not surprising we're seeing the kind of scenes that we are this winter and last winter.
The government insists the delays are part of a well-planned system and that cancer operations and time-critical procedures will go ahead as planned. But all many people can see is a cherished service sinking deeper into crisis. Neave, Al Jazeera, London.